Hey guys, this is Brandon with Low T Nation again. Just kind of hanging out in my kitchen tonight. I just got off the phone with a couple of doctors that we work with. That's one of the beauties of what we get to do. We get to work with a lot of super intelligent, super great doctors. And one of the things that keeps coming up very much lately is the patients keep coming to these doctors, and they keep coming to us as well from other sources. And unfortunately, a lot of these patients, their expectations are incorrectly set on what they need to be paying for a good quality testosterone replacement program. Guys, it's not as simple as just letting your insurance cover the actual testosterone and giving yourself those injections and calling it a day. You can't do that. That's absolutely, and in a lot of situations, that's the worst way to go about it. A lot of guys are actually better off not even taking the injections than just taking testosterone alone and shutting down that HPTA. The HPTA is a hypothalamic pituitary testicular axis, and if you don't know what that is, don't take testosterone yet. Do some research, learn about the axis, and learn about the other co-traveling agents that you need prescribed to you to make sure that we keep everything in your system, your testicular health, your pituitary health, and also your overall health intact with more things than just testosterone alone. All right, a good program is going to be obviously testosterone, but also HCG, and usually, if not all the time for an individual patient, at least some points in time while they're on therapy, they're going to need an estrogen blocker like Arimidex or aromatase. And also, if you're family planning and you're thinking about having kids, you're going to have to look at Clomid as well. Okay, those are just the pharmaceuticals that you need to be paying for at all times while you're on a program. And unfortunately, guys, of those 4 pharmaceuticals, your insurance is only going to cover 1. It's not going to cover the other 3, hardly ever. All right, but that's not where your real expense is going to be. Think about all of these hidden issues, and this is like, we've been through this a million times with a million guys, right? They come in, they think they're going to get something for X amount because that's what they can actually see on a receipt, but it ends up costing them a fortune, and not just in money, but in time and frustration as well. Your deductible at the beginning of every year is something that you really need to be in tune with, and the way that your insurance pays when you haven't paid through your deductible. Okay, some insurances won't pay anything until your deductible is paid, and deductibles now are averaging $4,000 and $5,000. So you're already looking at $4 or $5 grand out of pocket just to try and run the program the right way, and the expenses come from doctor visits and labs. Labs are outrageous, guys. The basic panel that we run, the introductory panel that we run on guys, can be from $800 to $1,000 depending on what lab you go to get them done. All right. Now, luckily enough, here at Low T Nation, we actually have hospital buying power for our pharmaceuticals and our labs, so we can do that tremendously cheaper. Okay, but if you don't have the luxury of using a clinic like ours, those are things you really need to think about. Okay. And another thing that we do is we drop ship everything to the patient's house. It is so convenient, all right? And we really believe in the efficacy of injections over creams or pellets or patches, and that's obviously another video for another time, but injections are where it's at, okay? And we can't drop ship the injections to you because most of the insurances, their standard of care dictate that the shots are either done in the office or you buy the prescription from a pharmacy and administer at home, okay? We're not allowed to drop ship them to you. What we actually are able to do is drop ship everything that our patients need once a month to their house. So the box shows up on their front door. They have testosterone in it. They have their Arimidex or their anastrozole in it. They have HCG in it. If they're family planning, there's Clomid in it. And also all the needles they need, insulin needles and the 3 mLs, all the way down to the actual alcohol swabs, okay? That convenience is worth not only money paying for that service, but it's worth a lot in your time as well, because if every single week you have to go to a doctor and get a shot, like how much is that going to cost you, in time and just wear and tear trying to make all of that happen. Also, if you have to go to the pharmacy and buy all these individual drugs, that's outrageous. These drugs get expensive, okay? And if you have a really good insurance plan that might cover 1 or 2, you're still paying the copay on those as well, all right? But even with great insurance, let's say you just want testosterone, you need to be medically supervised the right way, okay? You have to be medically supervised, and that means normally, and I'm not trying to offend any doctors out there or trying to offend anyone's individual doctor, but if your doctor hasn't been specifically trained on how to do hormone replacement, I would really consider finding someone that has, because guys, they don't teach hormone replacement in med school the way it needs to be taught. All right, if you have a doctor that's gone to A4M conventions, or they're taking specialty hormone replacement or testosterone replacement training, then that's awesome. They'll know what to do, okay? But if your doctor doesn't understand that they need to be looking at your estrogen levels, if your doctor doesn't understand why HCG should be a part of every testosterone replacement therapy, then find somebody that does, okay? And usually you're gonna pay a little bit extra for a doctor like that, but you're also gonna pay for those labs. A good doctor's gonna run labs on you anywhere from 2 to 4 to sometimes 6 times a year, and if you don't have a good coverage on your insurance and you're paying 30% of $800 or 30% of $1,000 every time, those get outrageous. You see how all this stuff can add up? So guys, think about using a program, and there's a lot of them out there, okay? We are definitely one, but there's other ones other than us. So use a cash-based program, because with our program, a guy comes in and if he wants testosterone replacement, it's about $300 a month, and he gets all the drugs he needs: anastrozole, testosterone, HCG, Clomid if needed, all the needles, everything that that guy needs to administer the program is drop shipped to his house. And once he's on our program, he gets unlimited doctor visits and unlimited lab work anytime he needs it. Okay, we're going to see the guy 2 to 3 times a year in the office to get lab work, and we're going to call them every month just to make sure our medical supervision is on point and taking care of these guys as much as we absolutely can. But the convenience factor of being on a program like this is also worth something, and something significant in my opinion. No trips to the doctors other than 2 or 3 times a year to get your blood work with us, okay? And we can even give you a LabCorp rec just to go to your local LabCorp and have it done on us. No trips to pharmacies. No trips, running out at the last minute because you're out of needles. No trips going back to the pharmacy because your HCG got left out of the refrigerator or something like that. Anytime something like that happens, our patients can call us up and we take care of it for them. And it's not just us. Good hormone replacement programs are doing this. So again, guys, just because you can get testosterone covered and only have to pay about 20 or 30 bucks, a month every time you go and pick it up, that does not mean that's what the program costs. You're paying for medical supervision, you're paying for labs, you're paying for more prescriptions than just the testosterone. And also don't forget about your deductible, don't forget about your copay, and don't forget about your time. If you're running all over creation every single week to find one more component, or one more prescription, it's really going to impact you. It's going to impact you financially, but it's going to impact the effectiveness of the program as well. Because here at Low T Nation, we have a saying that says convenience equals compliance, because you're always going to have the drugs when you need them, when it's convenient, right? Our program is so convenient. Every month, the box shows up. When you need the injection, it's there. It's in your pantry, or it's in your fridge, or wherever you're keeping it. And that kind of compliance of always being able to give yourself the shot when you need it is going to equal effectiveness of the program, because you're not missing shots of HCG, you're not missing shots of testosterone, your estrogen levels aren't going up because you ran out of a Arimidex a couple of days ago. Okay, so again, make sure you take all of these factors into consideration, not only when you're evaluating a doctor, find somebody that's been specifically trained on this, please, but also when you're pricing out a program, because up front, some of these programs look pretty cheap, but when you add up those costs 6 months and 1 year into it, you've paid a lot more than $300 or $400 a month. All right, just hope this is good information for you guys. If y'all have any questions at all, don't hesitate to reach out to us. The website is lowtnation.com. You can get a hold of us a boatload of ways there. You can call us at 866-FIX-LOW-T. I'm Brandon. You can email me at lowtnation.com as well, or just leave us a comment in the comment section. Thanks, guys. Have a great night. See ya.